Hello, and welcome to the September edition of Let's Talk Sullivan. Along with our chairman, Robert Doherty, my name is Michael Brooks, the vice chairman of the Sullivan County Legislature. The purpose of our Let's Talk Sullivan series is to inform the residents of Sullivan County what's been transpiring that month in the legislature and the important issues that are before us, and to dive deeper into those so you, the residents, have a clearer picture on our direction and why we're doing what we're doing. So I'm going to start off with our chairman, Robert Doherty.
Hey,
Hello,
how
Rob.
Mike?
And Rob, could you just talk about the latest COVID-19 stats in the county?
Sure. We currently have 13 active cases. We're currently at 50 deaths. We have 56 people isolated. Total since early March, we have 28,354 people tested and 1,541 confirmed cases. We currently have one person hospitalized and one person on the ventilator.
With September's edition to Let's Talk Sullivan, we have a couple guests with us. And before we get to our guests, and before I mention them, I'm going to answer a question that was sent to us by a member of the public. The question reads, what is the county doing to ensure the health of its residents with temporary residences and tourist attractions which bring in visitors? I'm not referring to second homeowners, but actual tourists. What safeguards have you put or are putting in place to protect our health going forward? Simply stated, like we've been doing since the beginning, is education and contact tracing. There is a large responsibility on business owners to, if you don't wear a mask, you don't go into the business. And it's up to the business owners, the individual business owners, to enforce that. As we've been stating right from the very beginning, that take personal responsibility for yourself, for your actions. Wearing a mask, washing your hands, we've all heard it many, many times, and please continue. But that is the way that we are proceeding forward. It's no different than before. And we've been successful, and we fully expect to continue to be successful by adhering to those simple measures. Now, with us today, we have two guests. We have our county treasurer, Nancy Buck, and we have the CEO of Garnet Health Medical Center, Jonathan Schiller. First, I'll go to Nancy Buck. Hello, Nancy. I'm going to ask you about the fiscal condition and prognosis for our county. But first, given this opportunity, could you explain what you and your office do for the county?
You know, I really appreciate you asking that because my office is a multifunctional office. I hold many titles, one being Chief Fiscal Officer of the county. As Chief Fiscal Officer of the county, everything flows through my accounting department. All the banking, all the financial, every department can do their own financials, but in the end it all comes down to this office where at the end of the year with the auditors and everything gets compiled together and we look to see where we are financially at the end of the year. That's one section of the department. We're also delinquent tax department. And that, so you understand the function of it, this year alone was no different than any other year. But when the taxes got turned over for 2020, the taxes from the towns that were unpaid, the dollar amount was $24 million. And we've been collecting on that $24 million, and we have the 2020s down now to around $17.8 million. But I have 3 people, and it's a high volume office of checks and money coming through. I have a real property department, and that's our foreclosure department. After someone hasn't paid their taxes for 2 years, unfortunately, we have to start that process, but it's a necessity. Besides, it's a New York state law. It's a necessity to keep people paying. If we didn't enforce it, you rob Peter to pay Paul. So we also, my office does the room tax, where there's been a lot of talk about the room tax. That's also known as the bed tax. We enforce that. And we also enforce the solid waste fee. That's put on the tax bill. I have a person in my accounting department that works with DPW, that's the Department of Public Works, on all of the landfill, the money that comes in and the issues. I have been also given real property recently. That's the office that does tax mapping, and it's an enjoyable challenge. Another title that I hold is I'm public administrator, and I'm also the enforcing officer, and that's with the tax department.
So many hats.
Many hats.
So could you explain our fiscal condition currently?
In Sullivan County, we have two big revenue sources, and our two big revenue sources are real estate tax and sales tax. And sales tax has been a very hot subject. I will tell you that we're in better shape than I thought we would be, and that's the honest truth. I predicted by this time we would be a couple million in the hole. Right now we're hundreds of thousands in the hole. I have been very lucky that the state lets me look at a chart. I can get it every quarter to look at, and I'm not allowed to disclose it, but I can give you information to say the reason that we are in better shape than I thought we would be is because of the sales tax that's imposed on all online, on the taxable online items. So we have had a lot of visitors in our area, and we've had a lot of people that stayed home because we don't have a lot of retail here, and they've been doing online shopping, and that has been a huge savior for us. There are other factors, but that, again, I just mentioned that we know there's been a lot of second home people that have spent the whole COVID time up here. We've had a lot of visitors from all over the United States coming up, and we really know that because we're seeing it with our room tax. So our sales tax is doing much better than I anticipated, and now thankfully we're going back into with the casino opening up, and hopefully someday the water park will open up soon, and we'll get back on our feet. Unfortunately, it's going to be a 2-year at least. It's just because everything starts opening, it's going to take some time to catch up. I don't believe that we will hit our projected budgeted amount of sales tax, so we have a long way to go yet. This legislature, I'm not just saying it because you guys are here, you've worked really hard and made some really hard decisions to be fiscally responsible, and I appreciate it. I know it's been hard on some of the spending that went to some of the non-for-profits, and it's hard. It's hard for everybody, but we have to pay our bills. And what I have done with the legislator's approval was I borrowed TANs. That's a tax anticipation note. And I just mentioned that how much the 2020 tax bills came in. I borrowed against that. We got a very good rate. It was under 0.50 for interest. I did it for a short term. We will pay it off by May next year. It's not something I want to do, but we need cash flow. And again, when you have $24 million of unpaid taxes coming in, and your budget is depending on that, we have to do something. So I'm hoping that over the next few years we'll lower it and maybe get back down to not borrowing again.
So on the fiscal health of the county, how does the energy tax play into the fiscal health of the county?
We will know actually in a few months. I know that the projected is a couple $1 million, and I have to tell you from a personal stance, it's not one I love, as nobody does.
Nobody.
Nobody does. But it will help us out in the near future when our sales tax starts coming in and the figure's going to be up. I did contact the state and I asked them if there's a way that we can determine the rate of how much of that came in that's really from the energy, and they do have it separate. So we will be able to monitor that and keep a close watch on it. But I believe the projected will be a couple $1 million, and it's very needed. Unfortunately, we need something, and it was something that you came up with, and we'll move through with this.
As was mentioned in our previous Let's Talk Sullivan, when the energy tax was passed, part of what was put in that resolution was the sunset date, and this energy tax will sunset in this legislative term. And we wanted that in for a specific reason, because we've heard a lot from our constituents that a tax never goes away. This tax will, and I can't say it more firmly enough, it will go away. It was never an intention to be there forever and ever, and this is to help us get over this COVID hump, if you will. This has been tough on everyone, and everyone will participate in getting us through this as a county, and we fully believe that we'll be in much better shape because of it. I got a question for you, Nancy. You briefly talked about it, but could you just explain a little bit about schools and towns and making them whole?
Yes, we hear that all the time, and a lot of people don't understand it, and I think it's very important. School districts, as you know, their tax bills come out in January, and the schools collect anywhere up to November 20th. Every one of them has a different date. When someone doesn't pay their school tax bill, it gets re-levied on the town and county tax bill that comes out in January. New York state law that the counties are to make the school districts whole on or before April 1st. What that means is all the taxes that didn't get paid, that they turned over to us, the county, and we re-levied, we now have to pay the school. And every year, it's approximately $18 million that we have to pay out to those schools come April 1st. The towns, it's the same scenario. Again, if you remember the January bill that comes out is called the Town and County Tax Bill. It's called the Town and County Tax Bill because we're both on it. So the portion of the town, they have their own warrant, and when they reach it from collecting the taxes, say a small town, and their part of that tax levy bill was $10 million. When they've collected $10 million, after $10 million, they'll start turning the money over to the county. So their budget is made whole, usually in January or the first week in February, and then they start paying us over money too. So when you hear us, my office, I'll say, I won't say everybody, but my office, when we talk about making the towns whole, they make themselves whole, and they don't have to worry about that tax collection. It turns over to the county, and we're now a delinquent tax collector.
I think it's important for the folks who may not understand that or may not have known about that to have a clearer picture of that.
And another figure I like people to understand too, when we're talking fiscal, is our retirement. And we got a preliminary amount that our retirement's going to be, that we have to pay, is $10.2 million. I just told you we had to pay the schools around $18 million. And in a couple months before that, we're going to be paying over $10 million for retirement. You know, these figures are daunting, and this is true cash that we have to have. And that's why all these hard decisions that are being made by you, the legislators, are very important.
One last thing, Nancy. Could you please talk about the tax foreclosure auction?
Yes, it's very important to get this out there. We usually have our auction in June. This year we couldn't have it in June due to COVID. So right now there's an executive order by our governor that there could be no foreclosure auctions prior to October 15th. Right now our auction is going to be October 20th and 21st. It's different this year. It's an online only auction, live auction. So in the past, we would have up to 300 people in the room coming to our auction, bidding live. But at the same time, we did have online bidders. So we had it, both were happening at the same time. This year, it's on live bidding on the internet only, and I encourage and beg you to please go online and listen to they're going to have a seminar on it, and if you can't do the Zoom meeting, please go to it after. They're going to put it up there so that you really understand all the ins and outs of this auction. It's live at the moment. This isn't a 2-week that you come back and forth like in eBay. This is live at the time. I know it can be successful. We don't have much choice. We can't put 300 people in a room, and we're hoping for the best. But it's 2 days. On the October 20th is Bethel through Lumberland, and on the 21st is Mamakating through Tustin. And it's the same terms and conditions that we've had in the past. And I beg you to please review them. Do your homework if you plan on bidding. Do your research. I always say that before an auction. I won't have the opportunity this year. So please, if you're planning on bidding at our auction, read the terms and conditions and understand it. And if you have questions, feel free to call.
Like was mentioned earlier, our other guest is Jonathan Schiller, the CEO of Garnet Health Medical Center. Jonathan is joining us today to talk about the hospital, its current status, and activities. So Jonathan, welcome.
Thank you, Mike.
It's all yours.
Oh, thank you. So I'll share some information about the hospital and a little bit about coronavirus. Certainly with our with the coronavirus having been in the news, a couple of comments about PPE. New York State came out with a new mandate for all hospitals, nursing homes, long-term care facilities that they have a 90-day supply of PPE on hand. We do meet that requirement. We're all required to meet it by the end of October. And certainly a very interesting requirement, and really in anticipation of a second wave, which we have not seen. But we certainly want to be prepared. And PPE was a rate limiting factor for many organizations. A couple comments on testing. So we still have testing available for patients who are critically ill. And we have ordered point of care testing, which is what we'll call rapid testing. Patient comes into the hospital or urgent care, and we're looking for a result in the next 45 minutes. That type of testing is on order. Unfortunately, all the hospitals across the country are looking for the same thing, so there's a little bit of a back order with that. And then the last piece is the vaccines. I thought it would be worth mentioning that, and as recently as yesterday, this information changes all the time. Johnson & Johnson came out with information about their trials and what they're doing. So we're very optimistic and hopeful that a vaccine that is effective is released by the FDA when it's primed for the market, and that we can get that vaccine out to members of the community who are vulnerable, and of course to frontline workers, first responders, healthcare workers, and the such. A few other updates for the hospital, if you'd like.
Sure.
We started the coronavirus pandemic with our tents outside the ED to try and do respiratory triage and isolation. I have great news for members of the public who come to the hospital now. Those tents are gone. We've made some significant construction modifications to our emergency department that have given us structural separation and isolation for patients that come in. So now, when we have someone come in, they can come inside the building. It's all negative pressure. It's really state of the art, and a great way to keep people safe, especially with the winter coming up. Tents were not going to do it for our community, so we were able to make those changes. And visitation at the hospital for patients with family members who have loved ones in as patients, we're really still very restrictive on visitation. That's a New York State mandate, and we're following it. There is visitation permitted, but it's very restricted, and that's for obvious reasons, for everybody's safety and benefit, especially for the vulnerable patients that we have in our care. We have seen some reduction in outpatient services through our Garnet Health doctors and urgent care, and what we are seeing is that some members of our community, and this is happening nationwide, have a little bit of a reluctance to go to the doctor for what we would consider routine checkups and things like that, minor care. But please know that all of our locations are as safe as they can be, and we ask our members of our public, please don't delay routine care or treatment. We do see patients come in our emergency department who thought they could delay something and then wind up with a larger problem that we have to handle. So get that preventive care if you can. I have some great news for our community about telemental health and telemedicine. We received a $1.2 million federal grant to grow a telemental health program, and it's a 4-year grant for $300,000 a year. And what it will permit us to do is purchase all of the technology as well as hiring the psychiatrist to be able to provide telemental health services at all of our outlying locations, including our residents in Callicoon, who will be able to receive telemental health services in the emergency department there as opposed to being transferred to Harris. So it's a great win for the community. It'll take a few years to build up all of that infrastructure, and we're very thankful for the federal government approving that grant for us. And one last thing I have for you is that our hospital is clinically and financially strong, and we are opening up yet another new service because of what we've seen with the pandemic and the impact it's had on the mental health across the country, and our community has no immunity to that. We are opening up an outpatient mental health clinic on October 1st. Which will be able to provide residents of Sullivan County with another treatment option or another service offering that will hopefully help make a dent in some of the challenging mental health issues that we see.
Very good.
Thank you.
Now, with just reflecting back a little bit, because the year of COVID-19, there's been quite a learning process.
Yeah.
And I'm sure there's things that you've learned at the hospital, such as ventilators or what have you, as we've moved from the early part of the year until now. What are some of those things that you've learned, whether it's the ventilator use or other things? I'm just curious on what the hospital has learned in the healthcare industry in general.
Sure. Tremendous amount of active learning going on in our industry globally and certainly nationally here. For physicians and others caring for patients who are COVID-19 positive. And what we first started out with, and as everyone heard through media and family reports, is that the first go-to was the ventilator. Really, if a patient decompensated, that was where we went. That was the main modality that was available. And what we have learned is that we really need to look at that as a second or third line modality, that we have options and opportunities to treat patients with steroids to help with their respiratory process. We can also utilize a medication that's actually on federal distribution called remdesivir, which is very effective. And there's actually a treatment that requires no medication. It's referred to as proning, which is a patient lying on their stomach about 16 hours a day, relieves a tremendous amount of pressure, it relieves from the lungs, and provides for a little bit better oxygenation and exchange. And then if those treatment modalities are not as successful as we'd like, and there may be other adjunct therapies such as respiratory therapy treatments, if they're not able to get patients to where they need to be on the oxygenation, then we will look to use the ventilator as a last resort.
And let's hope, I think, in the U.S., I think there's at least 4 phase 3 trials, right? So let's hope by sometime soon that we'll have that as well. Robert, is there anything? Yeah. Jonathan, thank you very much.
Thank you, Mike.
And as I have mentioned before, the hospital and Jonathan are tremendous assets to Sullivan County, and we do thank you again, Jonathan, for joining us. Now we're going to do a little Q&A with our chairman, Robert Doherty. And we're going to start with the Sunset Lake Development Corp. So I'm going to ask Rob a question. The Sunset Lake Local Development Corporation's progress in finding a management company for the county's care center at Sunset Lake and certified home health agency, what's the status on that, Rob?
Okay, so on September 24th at 4 o'clock, there's a meeting of the LDC, and they are going over the RFP that they're going to put out so that we can see who's interested in managing the healthcare center and the CHA. And then that goes out. That usually takes about 2 weeks, and then the responses come in, and then they'll be charged after that with the duty of narrowing it down from all the people that apply to be part of the group to their charge is to bring it down to 3, and the legislature then must pick the one out of those 3.
And next question for our chairman is about the upcoming DPW surplus equipment auction. Rob?
Okay, so as Nancy was graciously telling us before about the land auction, every year we have a DPW surplus equipment auction, and that can be found at aarauctions.com. There's approximately 50 lots. 18 of those lots are Ford Focuses between the years between 2009 and 2014. The conditions are fair to good. You're going to be able to go online at aarauctions.com, and you'll be able to view everything. The auction starts on September 25th and runs through October 12th. There's 50 lots in total. 18 of them are Ford Focuses between the years 2009 and 2014. They're in fair to good condition. There's other items such as fluorescent lights, a couple of trucks involved, heating and cooling equipment, typewriters, a wheel balancer, the general things that a DPW would use. So feel free to go online and place a bid.
All right, next question, Rob, is could you just explain the reasoning and thought process behind the canceling of the hearing and vote to potentially exceed the state mandated property tax cap?
Sure thing. So when we were going over all the possible options to avoid going into a deficit situation, one of the options that one of the legislators had mentioned was to be able to exceed the tax cap. As everyone's been listening to anything I've been saying for the last couple of months, I refuse to go over the tax cap. This legislature will not go above the tax cap. We feel that the energy tax, which is not just on property owners and homeowners, that encompasses anyone that uses electricity inside the county, was enough, and we feel that we should be able to stay within the tax cap. And if for any given reason that we're not, it's up to us to tighten our belts. It's not up to the taxpayer to tighten their belts because we're afraid to make tough decisions. And so I can promise you we will not exceed the tax cap and that we will tighten our belts.
Speaking of tax cap and also the taxpayer, it leads into we're winding down on the census taking, and as been mentioned many times before, where we, Sullivan County, are way behind. One of the things being so behind puts us at risk is losing some federal dollars, and roughly the numbers, for every resident or individual that does not take part in the census, we could lose up to $3,000 in federal aid. And just think about that for a minute, what that means, because the only way to make up that, we want to be responsible in running the county government, but obviously less dollars, that falls on other folks' shoulders. So it's so important, if you haven't already, if you know somebody who has not participated and filled out the census, please have them do that. I'm going to share a website with you. It's my2020census.gov. That's my 2020census.gov. Please go there. It takes you, I did it, just takes you a few minutes and you're done. Or, if you like, you could place a phone call, and that's 844-330-2020. Once again, that phone number is 1-844-330-2020. Moving on, Robert,
Yes, sir.
talk to us about the general election.
Okay, so the general election is November 3rd, as we all know. There'll be 3 different ways to vote in the general election. You can ask for an absentee ballot. I believe that the request for an absentee ballot is being mailed and to you, and then you can ask, then you have to fill that out and send that back, and then they will mail you an absentee ballot. The early voting starts October 24th, and that will run to November 1st, which happens to be a Sunday. Yes, the government center for voting purposes during this time frame will be open, and come on in and feel free to vote, or you can do it the old-fashioned way and just go vote in person. Those are your options. So you have 3 different options. Please vote. Please make your voice heard.
Okay, Rob, next question. Please, for the residents of the county, talk about the status of the reorganization of the Sullivan County Human Rights Commission.
Okay, so we had 2 public hearings on the Human Rights Commission. The first one was so poorly attended, I requested to have a second one. So we had a second one. More people came out for that one. I think human rights is essential. Our Human Rights Commission currently is not functioning the way it should be functioning. And I think in these times, I think that the outreach part of the Human Rights Commission is so essential. And I think that we honestly need to bring this to a vote, and then most likely will come to a vote in October or the November meeting. I feel that the outreach part of it would have been so helpful during these very turbulent times. I feel the legislator, we need the outreach programs in Sullivan County. We have a very diverse group of people that live here, and I think that we owe it to the people of Sullivan County. If you read the law, you understand that we're using the Tompkins County model, and that we're mostly focusing on the outreach programs, which I think are an essential part of what the Human Rights Commission does.
Thank you, Rob. Last thing I want to ask of you is if you could just describe a little bit about the issue regarding the Millennium pipeline.
Okay, so the Millennium pipeline came in with all this fanfare and all this fun stuff, and they said they were going to spend $236 million in the region. So they built 2 compressor stations, and the one compressor station happens to be in Highland, New York, and they paid their tax bill last year, and then the assessor in the town of Highland worked with the state of New York, and they assessed them at $86 million. The fine folks at Millennium turned around and said, well, we're going to pay $30 million. So we turned around and said, well, we think it's $86 million. So obviously the school and the town were not happy about that, either was the county. So just so we understand, on the $86 million tax assessment, the school gets about $1.1 million. The county would get $600,000 and change, and the town gets about $400,000 and change. So we're talking big numbers here. If you were to cut that in half or even more than in half, it would be a substantial hit to any one of, those entities. We're gonna enter into litigation where the town, the school, and the county are all together. We're all on the same page. We're all in agreement that the Millennium should be, assessed at the $86 million. And so, this is a prime example of how, when you have a common interest, everyone can come together and, fight for what they, think is right. And I think it's fair.
And the obligation of the county is 33.
So the way it works is, even though the school gets 1.1 million and the town gets 400 and change and we get 600 and change, we're splitting the bill 3 ways.
Okay, all right.
And that's how it works. And the bill should be in or around $10,000 to $15,000.
Well, thank you everyone for joining us. We covered a lot of ground today. Thanks go out once again to Jonathan Schiller of the Garnet Health Medical Center, and our county treasurer, Nancy Buck, and our chairman, Robert Doherty. And I'd be remiss if I didn't mention our communications director, Dan Hoos, the man behind the camera. Thank you, Dan. And we hope that as we move forward with Let's Talk Sullivan, that this will truly be a resource and a place that you can go for information and just get the reasoning behind the decisions and some of the things that are going on in the county. We want to be able to talk directly to you, the people and taxpayers of Sullivan County. If you have any questions or like to submit a question for us, I'll give you a website, sctownhall@co.sullivan.ny.us. I know it's a long one. I'll give it to you again. It's sctownhall@co.sullivan.ny.us. So please submit questions. We'll be more than happy to address them. And as the weather gets colder, we're now into autumn, please be safe. Until next month, bye for now.